Bismillahirrahmanirrahim and Assalamualaikum warahmatullahi wabarakatuh. Dear brothers and sisters, welcome to Day 2 of Ta'aruf Week, Semester 1, 2021 and 2022. I am Afifzul Kapli, your MC for this session. Prior to starting our event soon, I have a few important announcements to make. Firstly, please ensure your internet connection is stable for the smooth running of the session. Next, if you have any questions for the speaker, please write them in the chat box provided on the platform. Last but not least, you are also reminded to fill in the IIM Health Declaration form provided in your Telegram group and checkbox by the end of Ta'aruf Week. Each student is compulsory to complete it. Alhamdulillahi Rabbil Alamin, wassalatu wassalamu ala ashrafil anbiya wal mursalin, wa ala alihi wa sahbihi ajma'in. Let's start our session with Furqan Al-Fatiha. Distinguished guests, ladies and gentlemen, we are indeed honored to have Dr. Siti Masitah Jamaluddin, Chief Medical Officer of IIM Health and Wellness Center, for a briefing session with IIM Health and Wellness Center of Ta'aruf Week Semester 1, 2021 and 2022, as her presence really means a lot to us. Thank you to Dr. Siti Masitah Jamaluddin for your time and support in attending this program. Distinguished guests, ladies and gentlemen, without further ado, now it gives me great pleasure to respectfully invite Dr. Siti Masitah Jamaluddin, Chief Medical Officer of IIM Health and Wellness Center, to deliver her speech. Please welcome.
Thank you, Mr. Chairman. Assalamualaikum warahmatullahi wabarakatuh to the Ta'aruf committee and then the student who attended these courses. Actually, it's reminiscing the memory about 20 years back when I also attended exactly the same Ta'aruf, but the difference was it was physical, face-to-face, but this time around we are meeting online. So let's not to have a further delay. My topic today is on the IIM health benefit and anything related to health for the students in IIM while they are being the student here. So let me share with you my presentation. I think the committee have to disable so that I can share with us my presentation today. Can host disable the screen sharing so that I can share the screen? All right, I hope that everyone can see my presentation here. This is about the Health and Wellness Center, and the outlines of my presentation today will include on the medical benefits for students, the COVID-19 operation room that is run by our clinics, and we also have a sister primary care clinic in Kuantan, which is called a family health clinic, and also we have the hospital, IIM hospital in Kuantan, which is called SASMEC. I will explain further on this topic one by one, and I hope that you will pay attention, and if you don't understand, you may ask the question at the chat box, or also you can relay the question to the committee later on. Okay, a brief overview on the IIM Health and Wellness Center. In short form, you call it IHWC. We have 2 branches, one in Gombak and one in Gambang. This is at the Foundation Center for Foundation Study. And what are the services available and provided by our center? We have outpatient clinic, we have emergency services. We also run for the public health and health promotion. We do have a basic radiology, which is mainly the X-ray, and basic medical laboratory, and also administration, which is related to the health management. Let's go to the medical benefit for the students. Okay, we have to go for the definition. What is the student defined by the benefit? It's a full-time student. All full-time students who are not covered by any other agencies. And how it's defined with the university clinic. It's clinics in the university campuses, which is actually directly run by the IIUM. We have IHWC in Gombak and Gambang, and we have Family Health Clinic, or known as FHC in Indramayu Kota campus. And dependent family members is for the undergraduate and postgraduate is either master or PhD. The coverage is only for the students, but the wife, the children are allowed to get treatment in the university clinic, but they have to pay in full per session. The source of treatment for the student, medical treatment may be obtained from the university clinics or any government or public university medical center. It has to be public university because some of the private university also running their own medical center. So IIUM will only cover for the government or public university medical center, in which the student has been referred to such a center by our medical officer for second opinion or treatment, or there are certain cases that they can revert back the follow-up to the university clinics, but some of the cases we allow for follow-up in the government or public university hospital. As like I said earlier on, the student's dependence, the medical treatment may be obtained from the university clinic with full fee. If a student is taken ill outside the normal residential area and the distance prohibits him or her from reporting to the sources of treatment, the treatment should be obtained from the government hospital only or public university hospital and informed to the university clinic. Then both procedure has to be done, government or public university hospital, and they have to inform the university clinic, in which this is the purpose. One is to inform, the other one is to see the coverage for the guarantee letter. For those students study at the Gombak, KL, Pagoh, and Gambang, they will give a call or email to this number. Mainly it is IHWC Gombak, or you can email that healthcenter@iium.edu.my. While in Kuantan campus, for those in other kuliah that is located in Kuantan, they may call the administrator in charge of each kuliah, where in Kuantan the operation will be a bit different, where the guarantee letter is produced by kuliah. Payment of such treatment could be reimbursed provided that the receipt of bills and prescription are verified by the university clinic. Any treatment taken outside Malaysia is not covered by these rules. But there may exception for cases where student has been deputed by the university for a special purpose, and the university bears all the traveling and other expenses of the student during stay abroad. So in such event, treatment should be sought from a government or similar hospital, and reimbursement will be decided case-to-case basis, as in the case of the staff. Students who are on study leave are not normally eligible under the student medical benefit scheme. And pre-admission chronic medical condition, we call it as a pre-existing illness, means that you already have the illness, then you enroll your study in IIUM. So these are the illnesses which is not covered by our student medical benefit scheme. All right, what about the eligibility? The university will pay all the government and university hospital charges incurred by eligible persons as defined before, providing that the referral was made by the university clinic and the guarantee letter or GL was obtained prior to the treatment. Students will normally be admitted to a second-class ward at the government hospital or public university hospital. But if treatment is obtained from a private treatment center or in a higher class at the government hospital at the student's charge, all expenses will be borne by the students. So in the event where a student is warded at hospital for a period of more than 2 months continuously, the Dean of Students Affairs and the Director of Health Services of IIUM and any other person that they may like to co-opt will decide whether or not the treatment could be covered under the medical scheme. Okay, these are the courses which is not covered by university. Treatment and surgery for cosmetic purposes, non-conventional medical treatment or procedures. This is, for example, like acupuncture, or maybe you go for reflexology, so it's not covered. Alternative or unproven therapies, routine general checkup unless prescribed by physician of university clinic or approved by the university. Appliances like orthopedic aids, spectacles, contact lenses, artificial limbs, dentures, and unless considered as part of the treatment. Basically, all the consumables is not covered by university. Dental treatment outside the university clinic, any family planning procedures, specialist treatment for minor conditions which does not endanger patient's life, such as skin disease, pimples, acne, and whatnot. Health diet and supplements, injury or diseases obtained as a result of intentional act that endangers one, such as drug abuse and alcohol consumption and any activities deemed immoral by university. Pregnancy-related charges and pre-admission chronic medical condition and complication are thereof. In case of emergency, any accidents of life-threatening condition may be referred to the nearest competent treatment center. If this center happens to be a private one, the university clinic must be informed within 24 hours for the doctors to consult the treating physician and suggest the transfer to an eligible medical center as soon as the patient's condition permits. Means that once they are stable, as soon as possible, they have to be referred to the government hospital. If the university clinic is not informed or advice of transfer is not complied and the patient is kept further in the private medical center, the student will bear all the expenses. And I would like to mention about the medical insurance, basically for the international students as per requirement by the EMGS, or we call it Education Malaysia Global Services, and the Ministry of Higher Education before student is allowed to study in IIUM. So we are using Etika for the year 2021 and 2022, in which there's a co-payment of 5%, means that 95% is borne by the insurance company and the student have to pay the remaining 5% of the bill. So maximum coverage is up until 15,000 and allowed to utilize it at the private hospital. And reimbursement for emergency cases at government hospital applied on similar insurance coverage. And the insurance is handled by IUM, Student Affairs and Development Division. But there are special cases which is quite rarely happens. A director is empowered to make decision on any special case not covered by the rules of above. Okay, let's move to COVID-19 operation in Gombak and also Gambang and other campuses that we are covering. As I mentioned earlier, IHWC is covering for operation in Gombak, Gambang, Pagoh, and Kuala Lumpur, while Family Health Clinic will cover for the operation in Kuantan campus. Okay, this is the template. The function mainly to report new case or close contact to positive case or suspected case. We also run the isolation MAHALLAH. We do swab operation, and we will facilitate the COVID-19 vaccination related, but it's case by case. So this is, you can see earlier on, if you realize that the number of COVID operation is totally different from the outpatient clinic. So the COVID-19 operation numbers is 64215815 or extension 5816 or 3279, while we have a hotline. This is only for the emergency where the on-call doctor will be using. And we have different email. It is ihwcevent@iium.edu.my. So this is mainly for the COVID-19 operation in the campuses. Okay, if any of you becomes a positive case or suspected, you may realize that either the clinic or we have now the safety liaison officer will be asking a lot of questions. But bear in mind, you have to cooperate. We thank you for that because these are the information that is required by Ministry of Health, and we also have to do the reporting to the Ministry of Higher Education. We will ask on the patient's details, on the symptoms and the close contact in campus especially, and also the chronology, how the movement of the suspected or the positive case within last 10 days. So this is how it looks like. And we have the close contact in campus. We also will be asking close contact outside the campus. All right, reporting of COVID-19 related, it is mandatory to report if you are case positive, close contact to positive case or suspected case. Sometimes when you get into the campus, while doing the isolation, self-isolation, then someone from the Pejabat Kesihatan Daerah call you up and say that you are close contact, or maybe you have the notification in your MySejahtera saying that you have the status from blue has turned to yellow, means that you are suspected case or close contact to positive case, and then you have to inform the safety liaison officer. If you get the notification at kuliah, you have to inform the SLO at the kuliah or maybe the dean. In MAHALLAH, you also have to report to the SLO or the principal. If during office hour, you can also inform the MAHALLAH office to get help. The university clinic will guide you accordingly, and hiding the information can be charged under Act 342, control disease, infectious control disease. Because nowadays, we acknowledge that you can do the test on your own using the self-kit. And if you were found to be positive, please inform the COVID-19 op room so then we can assist you accordingly. And we can also help you to do the contact tracing among your friends in the hostel. Okay, this is about the COVID-19 vaccination. I would like to inform that IIM does not keep COVID-19 vaccine in our primary care clinics. We don't have the vaccine. We only facilitate for you to get the vaccination at the PPV or the clinic nearby for you to complete your vaccination. Students are mandatory to complete the 2 doses of COVID-19 vaccination within 14 days observation post-vaccination. There are, for the CanSino and J&J vaccine, it's only 1 dose, which you have 28 days post-vaccination observation. For the international students who completed their vaccination at own home country and they want to sync the information into the MySejahtera, you have to bring all the genuine documentation and certified by your own embassy in Malaysia once you reach here and after you completed the compulsory quarantine. And how you would like to request for assistance if vaccination is not yet registered under MySejahtera despite of completed the vaccination. This can also happen to our local students. You can call our op room or you can go directly to the health district office, or known in Malay as a Pejabat Kesihatan Daerah. If you are in Gombak and KL, you can go to Gombak, Pejabat Kesihatan Daerah Gombak. If you are in Pagu, you can go to the Pejabat Kesihatan Daerah Pagu. If you are in Kuantan, you can go to the Pejabat Kesihatan Daerah Kuantan. All right, we were once in Gombak, became the PPV, but it's just a short while. It's more of the targeted vaccination. It happened on the 17th and 18th of August, and recently on the 8th of September. This is being done at the IIUM International Cultural Center. So we became the PPV and vaccinated the remaining of the student and staff who does not get the appointment yet. So, and then we talk about the isolation MAHALLAH. What is isolation MAHALLAH? Is to separate the high-risk students from the common population. Those, so then we want to break the change by separating those suspected or COVID positive patients from the normal population. So each campuses have its own designated area of isolation MAHALLAH. We will definitely separate the positive case, the close contact, or those with symptoms of respiratory tract infection while waiting for investigation. And in Gombak, KL and Kuantan, our primary care clinic also have to manage their own COVID-19 patients, means that they are positive, and they are falls into the category 1 and 2, then they will be managed on campus. But for the Pago and Gambang, they need to be transferred to the Low Risk Quarantine Center or PKRC registered under MOH or MKN. So this is how it looks like. The isolation Mahallah is guarded by our dedicated auxiliary police, and with the red barrier to prevent non-related students from getting into the isolation area. And this is a COVID-19 swab operation. We do our swab. It does not really depends on the pejabat kesihatan daerah. We have our own team, either in Gombak and also in Gambang and also in Kuantan. So it's all done by our primary care staff. For on-campus contact tracing purposes, it's free of charge, only for the student and staff. And charges will be applied for cases occurs outside campus, but would like to be done at IHWC because we are doing it faster and you will get the result immediately. Charges also apply for staff dependents or international students returning to their home country, because one of the requirements for the international student, they have to make sure that the PCR is negative, so then they are allowed to go home. I would like to share with you, this is the latest list of what you call self-test COVID-19 approved by the Ministry of Health. So now it has around 19, and we are getting one of it to be kept in our clinic, but we are not giving it for free. It's just a service of making it easier for the students to get the test kit in campus. We are buying the one from Korea. It's a good one. With the sensitivity is also high, and we have tested with our positive cases on campus. Alhamdulillah, it works very well. It can actually be accepted by the pejabat kesihatan daerah in terms of reporting. And brief overview on our family health clinic in Kuantan. This is how it looks like. It is managed by Kuliah Medicine Kuantan in the family medicine unit. And this is also our hospital. Last time they call it Hospital UIE, IIUM Hospital, but now since last year it's been changed to SASMEC. It stands for Sultan Haji Ahmad Shah Medical Center. It's a tertiary center. So whatever problems you have to come first to the primary care center, means in IHWC or FSC. You cannot go directly to the medical center for treatment. You have to go to the primary care clinic first. And that's about it. I think, thank you. That's the presentation today. I give back to the committee.
Thank you to Dr. Siti Masitah Jamaluddin for a very informative speech. Now, I will open the floor for any questions to be asked to the speaker. Dear attendees, if you have any questions, please write them in the chat box. While waiting for the questions from the students, I believe Dr. Siti Masitah would like to have a few questions for us. Please welcome Dr. Siti Masitah.
Okay. I have a scenario which we often encounter in our clinic settings, in which students have problems. They are living with the family, means that they are on the semester break and they have they need to attend the emergency department in a hospital, the government hospital nearby the house. And how do they get the treatment without having to pay? Or how do they get the reimbursement if they go to the government hospital? Means that the parents pay first, and then it seems like it incurs a lot of charges. And how do they do it to get the reimbursement? Maybe anyone would like to answer the question?
Okay, Assalamualaikum warahmatullahi wabarakatuh. I am Adriana Naziha from Kuliah of Architecture. Okay, for your question, Doctor, I believe if students, they need treatment from other hospital when they are out of campus, they need to refer to IHWC and inform IHWC that they are getting a treatment from that particular hospital, which is as mentioned by doctor just now, the university hospital or the government hospital, and inform they require a guarantee letter. So if they inform the guarantee letter, the IHWC will prepare for the guarantee letter for them, and then they can refer the guarantee letter given by IHWC to the hospital that they attended for their treatment.
All right, but is a good answer. There's another one alternative means that the student have to go to the nearby klinik kesihatan and assessment being made by the doctor in klinik kesihatan, and they found out that your problem has to be referred to the tertiary center, which is the hospital. So that is also acceptable. We allow for providing the guarantee letter, or we allow for reimbursement later on if you are using your own money first. But what about the case if, for example, like Adriana is studying in Gombak, it's a lot easier that you can get the guarantee letter from IHWC. What about our friends now actually studying in Kuliah of Allied Health Science in Kuantan? How do they get the guarantee letter?
Okay, if they are studying in Kuantan, they need to inform the sister clinic of IIUM, which is the family health clinic. And then the method is still the same as mentioned before. So they when they get the guarantee letter, they need to inform the particular hospital that they get the treatment. And another way, they get the guarantee letter, and if they can be referred to the Sultan Haji Ahmad Shah Hospital, so they can get the treatment there.
Yes, that will be another options in which, like I said, that the students are getting the first assessment at klinik kesihatan. So the klinik kesihatan will give a referral letter to a government, or maybe they are referring the students to the SASMEC. So means that with the referral letter, the student have to inform the administrator at the kuliah. In Kuantan, it's not the family health clinic that producing the guarantee letter. It is the kuliah who are producing the guarantee letter. So the procedure is a bit different from Kuantan and the rest of the campuses. So hopefully the students in Kuantan is aware on about the guarantee letter. Thanks.
Okay. Doctor, do we have any other question from you?
I have a question. Means that now
okay,
one
I
of the
regulations. Sister Ainul.
Okay, we have now the regulation made by the Minister of Higher Education that you have to complete 2 dosage of COVID-19 vaccination. Since that there are certain cases that we have faced in which they have completed the 2 dosages, but it does not appear inside the MySejahtera. But they have the manual, card, they have the all the documentation. So how are you going to help the students, since that they are one of the our dedicated student union? How you are going to help the student just to assist them so that they have the vaccination registered in the MySejahtera as an evidence so that they can get back to the campus?
Thank you very much, Dr. Mashita, for the question. I would advise the student to always carry their the vaccination card with them. It could be in maroon color, or in some other PPVs it was yellow. But that is the proof that they have completed the vaccines, because it has the details and so on and so forth. But I do agree that having MySejahtera and details of their vaccination is very convenient for them. I would suggest them to email and reach out to the MySejahtera help desk for a few times until the problems is solved, because that is definitely much convenient. Otherwise, I think the vaccination card is enough evidence to show to they can explain their situation to the university management, if they encounter any problem, if they want to enter the MAHALLAH, like now we also can go outing. I think that they can also show the vaccination card. to the
All right. This will be an additional information on the manual vaccination card. If it's not registered in MySejahtera, it's a good advice given by you that they have to keep on reporting to the help desk in the MySejahtera. And the other thing is they can ask help if those in Gombak or in Pago or in KL or Gambang campuses, they can get helps from the IHWC op room, in which we will get some information. We'll contact the students directly and we'll get further details, and we will submit their details to the Pejabat Kesihatan Daerah to assist them. Sometimes Pejabat Kesihatan Daerah, usually from our experience, they are willing to help just to inform their colleague in MySejahtera. So doing both ways, inshallah, will help, because manual card will have some issues. They are afraid now because of emerging problems where there will be a fake manual card. But then the original manual card, it comes with the VTM series on the card. VTM is the registration of the vial that being given to the students. So the VTM, it could be either on the card or at the consent letter. So the student have to bring along both. So then the security and our personnel in the clinic will check, and maybe they can help to verify the originality of the vaccination. All right. So I think it's quite tricky, right? These two questions. If anyone have questions, then they can ask further or email to our op room or in clinic later on.
Thank you to Dr. Siti Masita for the questions. Now we proceed with the Q&A session. It seems like we have a question from Siti Farahia. Okay, Assalamualaikum, Dr. Siti Masita. I am Siti Farahia. My question is, may I know what should students need to do if they are infected with virus COVID-19, but we are living off campus? If we need to inform IHWC, through what platform should we inform, and what is the purpose of informing when we are living off campus?
Okay, answering to the question, it is mandatory to inform the IHWC not only for the operation, even though the students are living outside, then they have to report. So then we have to report to the Ministry of Higher Education. One thing is mandatory, it's a directive from the ministry. And secondly, there are many cases from our experienced people, even though the students are living outside, but they are having the contact, or they have the close contact living on the campus. So we are not only helping, just make sure that the students that are living outside is stable, means that they don't develop into severe category like category 4 or 5, but we also want to have the close contact living on campus for the contact tracing, for the swab, for the isolation and whatnot.
Okay, now we will end our session with Tasbih Kafarah and Suratul As.